Hello, good day everyone. Let me introduce myself in this video. Hello, I am Etonogestrel. Who am I or what am I? Well, to simply understand me, I am the generic name of a drug that a woman uses when they want to prevent pregnancy. Yes, you got it right. I am a contraceptive and I affect the hormones in the reproductive system of a woman. Do you know that I have two brand names? Isn't that fancy? I have named Emplanon and Nexplanon. And also I have a chemical name as C22H28O2. I know you're a bit overwhelmed about me having names, but let's proceed so that you'll know more about me. What are my drugs classifications? Well, you'll easily remember me that I therapeutically prevents fertility. And I have a pharmacologic progesterone congeners progestin. My pregnancy category is X, that is cross, which means I am not allowed for pregnant or lactating mothers. So there you go, you might have idea of what I am all about, but I know that you want to know more about me, so let's dig in. Let's go to the mechanism of action. What do I do? Well, I result a negative feedback mechanism in female reproductive system. I inhibit the release of luteinizing hormone when it binds to cytoplasmic progesterone receptor that subsequently mediated gene expression. This process leads to an inhibition of ovulation and an alteration in the cervical mucus. In this point, let me share to you my pharmacokinetics. So I am absorbed in the GI tract. I also bind to plasma proteins, being mainly albumin, followed by sex hormone binding globulin. So I am metabolized in the liver and I am eliminated renally. My half-life is 25 hours and I have a clearance rate of 7.5 liter per hour. So what is my indication? I am indicated for the use of women to prevent pregnancy. I am a reversible, long-lasting contraceptive that is administered subdermally in the non-dominant upper arm. So what are my contraindications? I should not be used in women who have known or suspected pregnancy, a current or past history of thrombosis, hepatic tumors, or active liver disease, undiagnosed genital bleeding, known or suspected breast cancer, and lastly, allergic reaction to any components of me, Etonogestrel. Let's proceed to the side and adverse effects per body system. In genitourinary, the very common is menstrual bleeding, irregularities, vaginitis, and breast pain. Common is leukorrhea or dysmenorrhea. In nervous system, the very common is headache, having 24.9%. Metabolic, weight increase, having 13.7%. Dermatologic, very common is acne. In gastrointestinal, the very common also is abdominal pain, having 10.9%. Next is respiratory. The very common side or adverse effects is pharyngitis, having 10.5%. Let's proceed to the local. This is my site implant complications. So there are bruising, slight local irritation, pain, itching, fibrosis at implant site, paresthesia, like events scarring, hematoma, redness, swelling, and abscess. Common is insertion site pain, implant site complication, injection site reaction. Next is psychiatric. The very common is 1 to 10% emotionally lability, depression, nervousness, libido decreased. Next is musculoskeletal. Common is 1 to 10% back pain. In hypersensitivity, common is hypersensitivity having 1 to 10%. Other common is influenza, like symptoms, pain, hot flash, fatigue. And cardiovascular is clinically relevant rise in blood pressure. So that was it. That was Etonogestrel, and at this point, let me share to you the nursing responsibilities before, during, and after administration. First up is before. Nursing responsibilities before administering the drug are the following. Before insertion of Etonogestrel, pregnancy of the client must be ruled out. Determine if the client has any contraindication and if the client is taking or intends to take any drug or food that interacts with Etonogestrel. You should confirm or talk about the client if the client understands both the benefits and the risk of the drug. Make sure that the client does not have allergies or to antiseptic or anesthetic. Make sure that the client do not have preceding hormonal contraceptive in the past month. Prepare the equipment that is needed in administering. Prior to insertion, read carefully the instruction. Next is during. Nursing responsibilities during administration. Insert drug under aseptic conditions. Etonogestrel should be inserted subdermally. When using combination hormonal contraceptives, insert the drug on the day after the last active tablet of the previous combined oral contraceptive. When using progestin only, Etonogestrel should be inserted on the day the next injection is due. When the client had a first trimester abortion or miscarriage, the drug must be inserted 5 days after. If client is not breastfeeding postpartum, Etonogestrel is inserted between 21 to 28 days postpartum. Last, let me discuss the nursing responsibilities after drug administration. So after, monitor implant on the AMR of the client for signs of migration. Monitor client for any changes in menstrual bleeding. Assess client for any abdominal pain which may indicate ectopic pregnancy of the client. Read instruction carefully for removal of implantation. To locate the implant, consult the user card. Confirm that client do not have any allergies.